February is Heart Health Month, and the American Heart Association's Don't Die of Doubt campaign was created to remind people that hospitals are still the safest place for you to be when medical emergencies strike.
Our Massey spoke with a cardiac surgeon at UT Health San Antonio and joins us now. Good morning, Max.
Good morning, guys. Obviously, there's a lot going on in the world, especially with medical news, and COVID-19 has really changed the way we think about health, but it is so important to remember that heart disease is still out there. It is such a big problem here in San Antonio and across the country. Easy things that you should look out for. So let's take a look. The graphic should be popping up on your screen. During this time, it is important to learn the warning signs for heart disease so you can catch it early, and that way you don't have to deal with something as bad as a heart attack. So here are the clear-cut symptoms of a heart disease. Shortness of breath with everyday activities, swelling in your legs, feet, and ankles, trouble sleeping if you lie flat, if you're feeling tired. Over the last year, people are finding it more and more difficult to recognize these symptoms, and it's coming at a big cost.
Patients are coming later, and we're not sure if it's because they're afraid to seek care because they're afraid of being in an environment where there is COVID, or whether there's confusion about whether their symptoms are from their heart disease or whether the symptoms are from COVID. So we are seeing people coming later, and sometimes that can mean that with delayed diagnosis, delayed treatment, there can be worse outcomes, unfortunately.
The doctor added that they are seeing more and more cases, and they're seeing a different variety of cases. Unfortunately, the heart attacks, they're still coming in, but so are atypical symptoms of heart attacks that are more difficult to recognize. We are far from done. Coming up at 9:30, we're going to be talking about why it is such a big problem here in San Antonio and some easy preventative measures that you and your family can take. Mark, Stephanie.